Good morning. My name is Ines Muhirwa, student from Nesruengeri, Faculty of Health Science, Department of Biomedical Laboratory Science. Now the module is Applied Immunology. So the first question I'm going to present is, what are the risk factors of chimeric antigen receptor T-cell therapy? Second question is, how immunotherapy is to treat autoimmune disease? The third question is, how do T helper cell support B cell activation? The fourth question is, what is the isotope switching and how is it regulated? Fifth is, what are T follicular helper cells and why are they important? Last question is, what make a vaccine effective? So now chimeric antigen receptor T-cell therapy is the way to get immune cell called T cells as a type of white blood cell to fight cancer by changing them in the laboratory so they can find and destroy cancer cells. This type of treatment can be helpful to treat type of cancer even when other are no longer work. So here there is autological chimeric antigen receptor T-cell therapy process. In the clinic, where blood is taken from the patient, then white blood cells, including T cells, are separated out and red blood cells returned into the patient. So here we separate white blood cell from T cells, and remaining part of white blood cell are returned into the patient. So in the laboratory, T cells are engineered to find and kill the cancer cells. So an inactivated virus is used to insert genes into the T cells. Then the genes cause the T cell to make specific receptor called chimeric antigen receptor on their surface. So modified T cells, now called the chimeric antigen receptor T cells, are multiplied until there are million or more of these attached cells. The next step is in the clinic. In the clinic, chimeric antigen receptor T cells are put back into the patient bloodstream. Typically, after chemotherapy is given to make a space and continue to multiply. The last step is what will be happening in the body. In the body, the receptor are attached to the target on the surface of the cancer cell. The CAR T cells identify the cancer cells with the target antigen and kill them. The CAR T cells may remain in the body for some time to help prevent the cancer cell from returning. This is a diagram show the chimeric antigen receptor T cells. T cells with chimeric antigen receptor, they form chimeric antigen receptor T cells. Risk of chimeric antigen receptor T cell therapy. The first is cytokine releasing syndrome, where the CAR T cell multiple, they can release a large amount of chemical called cytokine to the blood, which can ramp up the immune system. The serious side effects from this release can include fever, low blood pressure, and organ dysfunction, ranging from mild to severe and life-threatening. Another risk is neurological toxicity. This treatment can sometimes have serious effect on the nervous system, leading to condition known as immune effector cell-associated neurotoxicity syndrome. This can result in symptoms such as confusion, seizure, and speech difficulty, headache, change in continuous shaking or twitching, and loss of balance. Other serious side effects are allergic reaction during the function, abnormal level of mineral in the blood, weakened immune system, lower blood cell count, and an increased risk of getting another type of blood cancer. The next question is how immunotherapy used to treat autoimmune disease. Autoimmune disease is a condition where immune system mistakenly attack the body's healthy tissue or cells. Example is hematoid arthritis, lupus, multiple sclerosis. The immunotherapy is treatment designed to moderate the immune system, restoring balance. This diagram shows the normal immune response and autoimmune disease. For the normal immune response, antigen invade, then body produce antibody, then antibody remove invading antigen, then antibody remain and protect the body for further antigen invading. For autoimmune disease, immune system form antibody to self-antigen. Antibody attack self-antigen, then inflammation and tissue damage occurs. And this is how the immunotherapy is for autoimmune disease. You can use the monoclonal antibody to treat as immunotherapy for autoimmune disease, but these are laboratory-made antibodies. That monoclonal antibody are laboratory-made antibodies that target immune cells or molecules involved in autoimmune process. They can block inflammation, reduce the activity of immune cells, or even remove harmful immune cells. And that is cytokinase. Cytokinase is a signal molecule that regulates immune response. Some immunotherapy treatment involve using cytokine to either boost or suppress a specific part of immune system. Cell therapy. These therapy involve modify a patient's own immune cells to make them more effective at fighting disease. For example, T-cell can engineered to target specific immune cells involved in autoimmunity. Checking inhibitors rebalance immune response by moderating immune checkpoint. There is cell-based therapy and non-cell-based therapy. For cell-based therapy, there is polyclonal trigger, auto-antigen-specific T-cell receptor trigger, and auto-antigen-specific chimeric antigen receptor trigger, Trojan DC, and auto-antigen-specific chimeric antigen trigger. For non-cell-based therapy, there is lower dose of interleukin-2, rimpomycin, autoantigen, and others. The fourth question is, how do T helper cells support B cell activation? T helper cell is subtype of cells that regulate immune response primarily by secreting cytokine. B cells are lymphocytes responsible for producing antibody. Cells of adaptive immunity, they are having B cell structure and T cell structure. And B cell we are having secreting, we have antigen representation, where the antigen come and bind and secreting cytokine, secreting antibody. And here on T cell we are having T cell receptor and secreting cytokine. Mechanism of T helper cell supporting antigen bind on the B cell receptor, and then B cell engulf the antigen on bacterium, then after engulfing the activated B cell undergo abnormal secretion. Then with the help of after B cell engulfing the process antigen displaying fragment on the surface of the B cell and bound to the MHC2 molecule. Then T helper cell, specifically T follicular helper cells, recognize the antigen MHC complex. They form antigen MHC